Your health, your wealth, your health, your wealth, your health for life. Your Health, Your Wealth is brought to you by BAF Insurance. Your health, our priority.
Welcome to Your Health, Your Wealth with Desiree and Chuck on Bobo Radio. Thank you for listening. Please stay with us for the next hour while we share health tips and chat with our special guest.
Welcome, everyone, to Your Health, Your Wealth, brought to you by BAF Insurance. Your Health, Your Wealth airs every Wednesday from 6:30 to 7:30 a.m. right here on 89.1 FM, Bobo Radio. So remember to tune in each week and tell a friend. You can also catch the shows you missed on YouTube on the Be Well, Be Healthy for Life channel. So don't forget to like and subscribe. Well, we're already in the month of March, and it's a special month for women.
That's right, Desiree. March is Women's History Month, and the 11th of March, we're celebrating as International Women's Day. So it's only fitting that our guest this week is a registered nurse, Eleisa Thelwell, who will be talking to us about many women's health issues.
I'm so looking forward to our chat with Eleisa because women's health issues are very unique. Women go through so much more than men do when it comes to health issues because, of course, we also have the added blessing of being able to bear children.
That's right, Des. We can't argue with that. I have maximum respect for women and the role they play building families, businesses, and communities.
Well, in keeping with our focus on women's health today, Lady K turns the spotlight on a condition that millions of women worldwide face: fibroids. If you enter a room filled with women, you can be sure that at least one will have had an experience with fibroids. Let's listen in while Lady K, your wellness coach, talks about understanding fibroids.
And remember, the podcast Be Well, Be Healthy for Life is also sponsored by BAF Global Group and can be found on YouTube. Lady K's episodes are released weekly on the BAF Facebook page as well.
Today on Be Well, Be Healthy for Life, Lady K, your wellness coach, talks about understanding fibroids.
We often hear women say that they have or had fibroids. I know quite a few women who have undergone surgical procedures to have them removed, and even a few who have had hysterectomies because of fibroids. What are fibroids? How serious are they? And is it always necessary to have them removed? Let's explore this topic today. Now is a good time to subscribe to the channel if you haven't done so. Hit the notification bell also so you know when we have new episodes that have been uploaded. Uterine fibroids, the correct term, are non-cancerous growth that sometimes appear in the uterus or womb of a woman during childbearing age. They can range in size from that of a small seed that isn't visible to large masses the size of a grapefruit that can make the uterus larger than it should be. A person may have a single fibroid or many fibroids at the same time, and in severe cases, there can be so many fibroids that the womb is expanded until it reaches the rib cage. In many of these severe cases, women may look pregnant when in reality they have fibroids. The good news, however, is that fibroids are not an indicator of uterine cancer and very rarely will develop into cancer. Fibroids are very common, and many women have them without ever knowing because they have no sign or symptoms. Often they're discovered by a doctor during a pelvic or antenatal or prenatal examination. For many women, however, the symptoms can range from manageable to severe and needing medical intervention. Signs and symptoms include menstrual periods that are extremely heavy and lasting longer than a week, spotting or bleeding in between periods, feeling pressure or pain in the pelvic area, the need to urinate often and feeling like the bladder is not empty, constipation, and unexplained back or leg pain. What exactly causes uterine fibroids is still unknown, but research and clinical data suggest that they may be promoted by the hormones estrogen or progesterone or genetic changes within the uterine muscles. ECM, or extracellular matrix, a substance that helps cells stick together, is present in increased amounts in fibroids, and therefore may also be a contributing factor, as well as family history. Fibroids can grow very slowly or rapidly, go through growth spurts, or may even remain the same size, but regardless of the origin and size, fibroids can be a problem for women who experience symptoms. Fibroids can affect women of all ages and ethnicities, though there is a higher incidence of fibroids in Black women, who also tend to have larger fibroids, more severe symptoms, and get them at a younger age. Although rare, fibroids can cause complications with pregnancy, such as restricting the growth of the fetus, causing preterm birth, and issues with the placenta. There are no known ways to prevent fibroids from developing, but treatment will depend on the size of the fibroids and the severity of the symptoms. Fortunately, there are many highly effective methods of shrinking and or removing fibroids that are non-invasive, meaning they do not require major surgery and therefore have minimal recovery time. There are also new medications to manage symptoms, so there is no need to suffer in silence, ladies, or worry about major surgery procedures that can disrupt your life for weeks on end. Talk to your doctor and get the help you need.
Be Well, Be Healthy for Life is brought to you by BAF Global Group. Remember, always consult your doctor before starting any new health and wellness regimen. BAF Global Group offers life, health, and general insurance, plus a full suite of financial solutions in the Bahamas, life insurance in the Turks and Caicos Islands, and affordable individual and group health insurance in the Cayman Islands. Visit us at mybafsolutions.com.
Chuck, imagine that. Lady K was just explaining that depending on the size of the fibroid and where it's actually located, that it can actually change the physical appearance of the female. Imagine that. But anyway, we're not going to spend too much time on anything this morning because we have a lot of information and we want to get it all in.
I know we have many listeners that's just tuning in. I know you're heading to work, dropping the kids off to school. We're glad that you tuned in to right here. We'll make your ride a little smoother and a little easier with a purposeful conversation about your health. We got the information to do that.
And thank you for tuning in.
It's time for us to introduce our special guest for today. Desiree, over to you.
Our guest today is registered nurse and my friend, Eleisa Thelwell. As a woman who has worked in healthcare for a very long time, she's here to share some facts and tips about women's health. Welcome, Lisa. Tell us a bit about yourself. How long have you been in nursing?
I want to answer that question, but then it will date me. And I like to consider myself to be more than young at heart. So
Okay.
my nursing training goes back to over 25 years. I worked as a nurse, and then I actually became trained as a midwife as well. My current role, however, is in the field of ultrasound, which also enables me to interact with women and enhance women's health as well.
Okay, so tell us a little bit about what is unique about women's health and also what you think are lifestyle changes that we can implement in order to actually better our health.
Okay, thank you, Desiree. I am passionate about women's health. You might realize that there might be a bias because, of course, I'm a woman. But we also recognize that women's health also impact not only the home, the family, children, and the community at large. So women's health is that branch of medicine that focuses on the treatment and diagnosis of diseases and conditions that affect a woman's physical and emotional well-being.
One of the things I definitely want our listeners to know is, based on not just historical but regional medical synopsis, is that women are very much the caregivers of a household. And with that being said, you can't be giving care if you are not healthy. So women's health is on the forefront of taking care of children, taking care of the household, taking care of the elderly. A lot of elderly folks are taken care of by younger women who are the daughter-in-laws or the daughters of the husband, things of that nature. That's been historical in our region. Do you find that women over the years have started taking better care of themselves?
I would say to some extent, but one of the most profound impact, I believe, is the woman's role as the bearer of children. Now, if her health is not at the optimum, it affects her unborn child. It affects those who she interacts with. And as education has improved, one would think that more women would have been taking care of their health, considering the profound impact it has on the home and society at large. But still, I'm glad that you have chosen to highlight, because yes, you are now helping to educate those women who somehow neglect their health care and don't understand the impact it has on the society. And we always have this familiar phrase, children are the future. Mm-hmm. And if our children are unwell, then our society will be unwell and the generations will suffer. And I know there's the nutrition, there's fertility, there's infection, there are chronic diseases that affect women. And one of the things that we often neglect is stress and social problems. And I like, Desiree, when you said that women tend to put themselves on the back burner. And believe me, I think it is maybe genetic. No offense, Chuck. I'm sure you have interacted with women like this, and it comes naturally that even if you have a need, you forget about your need because you are being of service to your family members, to your friends, to your community, to your job.
Are there any specific tests that should actually be done on an annual basis, or at least once a female becomes a certain age, you would recommend that it's done every 1 to 3 years? Can you just maybe elaborate a little bit on some of those tests?
Okay, so thanks to technology, we can prevent so many diseases. And our pap smear, it's one of those tests that we recommend that a woman should have done.
Miss Eleisa, let me backtrack and get this conversation. We have such a multi-generational and multi-nucleus families now. Lots of single family parents doing, split family homes, things of that nature. As a man, what age should I start thinking that my daughter should start seeing a doctor to be checked up and have these things taken care of? Because women have these conversations normally. And I'm trying to bring in men into the knowledge of, hey, you got to be smarter with the women in your life as a reminder. Hey, sweetheart, did you get this done? As as an outside looking in, what age should this start?
Okay, let's start with the breast because it is one of the most obvious, I would say, developmental features that we will see in a young woman. And it starts with a woman being able to examine her breast herself. So that young lady, that adolescent, that child, as you mentioned, that you interact with, it's about monthly examination to notice any change in the breast tissue. And practice becomes perfect. So I wish we were visual in order to show you what a breast self-examination is like. And that is done monthly, can be done in the shower, while lying in the bed, just knowing what the breast feels like is 80% of the journey. So that if any changes happen, you're first to know. And I always say, if I knew then what I know now in terms of my own health and care, I probably would have made different decisions in life. And so when we have the opportunity to tell our young ones and to teach them to take care of their own bodies, to know what's happening, know the changes that's happening in their own bodies. We could talk about menstrual health. There's so many things, documenting, even a simple thing as counting your menstrual cycle, to be able to say, I have a 28-day cycle, I have a 21-day cycle, I have a 30-day cycle. Where do you start? You count at the beginning of your period, and then when it starts, the next period, then you can say it's 28 days, it's 30 days, it's 25 days. Most women are able to say, I have my period the end of every month or the beginning, but they can't tell you what their cycle is like. All those things give you a clue as to what's happening in your own body. And let's talk about the pap smear. You asked about different tools, measures that we can use to assess your well-being. That's what we use to check the cells of the cervix, and that is done to a woman who has been sexually active. So it's not going to be to your teenagers or to your young adolescents. But once sexual activity begins, then you would do your annual pap smear. But why a pap smear? It can predict what's happening with the cells of the cervix. So even before you have a situation of cervical cancer, because cervical cancer has been linked to what we call the HPV, or the human papilloma virus. So once we can analyze these cells, we can pick up if there are any changes before you have a situation. So this, I think, is an important preventative measure. And also, thankfully, we now have a vaccine that's been given to our young women, to our children in high school, to prevent, to guard against cervical cancer. So we have moved leap and bounds, and that is amazing.
Yes. Miss Eleisa, again, going back to women's self-care and balance, do you think they should get involved in women's support groups or for like mental health?
Yes, that is so important. And as I mentioned, that's one of the things that we overlook about spending time. Yes, we should have support groups, women supporting other women, because believe me, women do turn to smoking and drug abuse and alcohol, sometimes coping mechanism. And there are support groups, even Cayman Islands, that help women. You have the Pink Ladies, right? And they provide support to women in times of crisis. And even without crisis, women should support other women. It may mean you need someone to talk to, someone to just listen, someone to not judge, someone to care, and also we need someone to just assist with the children when you need a break, when you need a minute just to catch some air for yourself, to just survive. Of course, we need the support of other women as we embark on this journey called life.
Thank you, Nurse Thelwell. We're going to take a break for a while, and then we're going to come back, and we have some questions about common myths and truths, and you're going to tell us which ones are myths and which ones are truths. Okay, so we'll come back and talk with you in a bit. Thank you so much for being a guest on the show.
My pleasure.
In celebration of Women's History Month, BAF Insurance salutes the women of the Cayman Islands. We know that everyday women are superheroes every day, helping others, loving and nurturing, taking charge and building our country's future. Happy Women's History Month from BAF Insurance, providers of quality affordable health insurance for individuals and groups of all sizes. Give us a call at 949-5089. Your health, your wealth, your health, your wealth, your health for life. Your Health, Your Wealth is brought to you by BAF Insurance. Your health, our priority.
So, Des, do you know what time it is?
What time is it?
It's time for me to welcome your colleague, Mr. Mike Adams of BAF Insurance, for our next segment, 3 Minutes with BAF, in which our sponsor, BAF Insurance, has 3 minutes to answer as many questions as they can about the company and what they can offer.
He only has 3 minutes?
That's right. Start the timer. Welcome, Mike, to Your Health, Your Wealth. Tell me about BAF Insurance Cayman.
Firstly, Chuck, I would like to thank you for the opportunity to be on your show this morning to share with your listening audience a bit about BAF Insurance and some of what BAF has to offer. BAF Cayman is a proud member of the BAF Global Group, comprising insurance companies that have been serving the needs of our Caribbean generations since actually 1920. Our company has been active in the Cayman Islands since 2009, and our business continues to grow year over year, supported by our loyal and diverse client base that values market-leading rates, simple but extensive plan designs, and access to the best medical facilities when they need it most, whether at home or overseas.
Is BAF licensed and registered?
BAF is licensed by the Cayman Islands Monetary Authority as an A-class insurance company and specifically approved to provide health insurance by the Health Insurance Commission.
That's really great to know, Mr. Mike. If you could choose one thing that makes BAF stand out from the other insurance companies, what would that one thing be?
Although BAF offers many advantages over other insurance companies, whether you are an individual member or a member of your company's health insurance group, choosing BAF means putting your confidence in BAF to provide the highest quality health insurance plans with the lightest impact on your pockets. And we offer member support services that meet and exceed all your requirements. Our member services provided by our local Cayman-based team are always accessible to support you, from submitting your applications or daily member claims to billing queries. You can always count on one of our team members to assist you.
Okay, Mr. Mike, getting close to the end of our 3 minutes. In wrapping up, are your group plans only for companies? And how many people do I need to make a group?
BAF Insurance offers both individual and group plans. Our group plans require a minimum of 5 employees and base rates starting as low as 150 CI dollars. The additional plans that require 5 employees or more is what we refer to as the BAF MedSafe Cayman Health Plus and the BAF Value Plan Enhanced 250, and the BAF Prestige Plan, our most robust plan, requires a minimum of 10 employees to form a group.
How can I get in contact with the company?
Very easy. You can just contact our individual agents, and or 949-5089 is our main office line to our receptionist, who would then transfer you to one of our sales agents.
And what's the information for my tech-savvy people?
Certainly, BAF website is accessible at www.mybafsolutions.com.
Your health, your wealth, your health, your wealth, your health for life. Your health, your wealth is brought to you by BAF Insurance. Your health, our priority.
I am Desiree, co-host of Your Health, Your Wealth. I'll be with you every Wednesday from 6:30 to 7:30 a.m. Your Health, Your Wealth is brought to you by BAF Insurance as a community service because at BAF, your health is our priority. Plus, the more you know about your health, the easier it will be for you to stay healthy, and your health is, after all your real wealth.
Yes, Desiree, there's nothing more important than our health. Hospitals are full of people with lots of material wealth, as well as those with little. If money could buy health, they wouldn't be there. So the next time you're tempted to neglect your health, just remember you can't buy it back.
If you're just joining us, you're listening to Your Health, Your Wealth with Desiree and Chuck. We're talking about women's health, and earlier, Lady K tackled the serious topic of fibroids. She's back, and this time she talks to us about skincare.
This is just not for ladies. Men have skin problems too. So skincare tips from Lady K, your wellness coach, are for men too. You can check out Lady K on her Be Well, Be Healthy for Life YouTube channel. Her podcast, Be Well, Be Healthy for Life, is sponsored by BAF Global Group, and episodes are released weekly on the BAF Facebook page as well. Let's listen in as she talks about caring for your skin.
Today on Be Well, Be Healthy for Life, Lady K, your wellness coach, talks about caring for your skin.
Did you know that the skin is the largest organ in the human body, and that the average adult has 8 pounds and 22 square feet of skin? It's one of the most neglected and misunderstood vital organs. Our skin does more than hold everything in place. It provides a watertight, airtight, flexible barrier between the outside world and our body's internal systems. And now is a good time to subscribe to the channel if you haven't done so. Hit the notification bell also so you know when we have new episodes that have been uploaded. Our skin is vital to regulating body temperature, producing vitamin D, healing wounds, and of course, providing the sensation we feel when we're touched. Skincare products are among the most popular in the world, and ladies especially spend untold sums to find the product that works just right for their skin. But don't worry, men. There are almost as many products for you, and more men are learning to take care of their skin. But how many of us know and understand our skin type and what works best for it? There are 5 basic skin types: normal, oily, dry, combination, or sensitive skin. Your skin type depends on several factors, and it can change depending on age and environment. The elasticity and comfort of your skin depends on how much water it contains, while the softness is affected by the oils in your skin. Normal skin is not too dry or oily, has barely visible pores, and a bright complexion. Oily skin has wider open pores and is more susceptible to blackheads, while combination skin can be normal in some places and oily in others. People with dry skin almost always have invisible pores, but more visible lines, and a dull complexion, and sometimes red patches. Dry skin can easily become irritated or inflamed, cracked, and even scaly. Environmental issues can greatly affect your skin. Dry skin is often worsened by windy or extreme weather, ingredients in soaps and skincare products, aging, long hot baths or showers that naturally just dry out the oils in our skin. To prevent dry skin, take shorter, cooler showers. Don't scrub while bathing or drying. Use a moisturizer while your body is still damp and reapply regularly. And use gloves while cleaning or washing. If you have oily skin, wash your face no more than twice daily, and always after doing an activity that made you sweaty. Use a gentle cleanser and avoid scrubbing your face. People with oily skin are prone to blackheads and pimples, but never pop them, as tempting as that may seem. And learn the word non-comedogenic. Look for it in your skincare products because it means it won't clog your pores. If you have sensitive skin, you most likely already know that. Your skin suffers from redness, it gets itchy, burns, or gets excessively dry when you use products that harm your skin type. Be sure to consult a dermatologist to help you identify the ingredients that trigger your sensitivity. And for the record, just because a product says for sensitive skin doesn't mean it will automatically work for you. Skin sensitivities are unique to each person, so take the time to find the right products and cosmetics that work for you. No matter your skin type, however, there are 6 basic rules to follow to give your skin the best care it can get. Number 1, drink lots of water. Hydration is essential. Number 2, avoid direct sunlight when outside. Wear a hat and sunglasses. Number 3, use a sunscreen, one that blocks both UVA and UVB rays. And number 4, moisturize regularly. Number 5, wash your skin thoroughly but gently each day and remove makeup before going to bed. And number 6, don't smoke. These simple rules can help you age gracefully with skin that hides it all.
Be Well, Be Healthy for Life is brought to you by BAF Global Group. Remember, always consult your doctor before starting any new health and wellness regimen. BAF Global Group offers life, health, and general insurance plus a full suite of financial solutions in the Bahamas, life insurance in the Turks and Caicos Islands, and affordable individual and group health insurance in the Cayman Islands. Visit us at mybafsolutions.com.
In celebration of Women's History Month, BAF Insurance salutes the women of the Cayman Islands. We know that everyday women are superheroes every day, helping others, loving and nurturing, taking charge and building our country's future. Happy Women's History Month from BAF Insurance, providers of quality affordable health insurance for individuals and groups of all sizes. Give us a call at 949-5089.
Your health, your wealth, your health, your wealth, your health for life.
Your Health, Your Wealth is brought to you by BAF Insurance. Your health, our priority.
Wow, that was super helpful. I learned so much about skincare, things I didn't know. Thank you so much, Lady K. And now back to you, Des.
Okay, so we're back with Nurse Eleisa, Nurse Thelwell, and we're going to ask her a few questions.
And one of the things, I thank you so much for being part of our talk today. And folks, this is all about women's health. This is to give you a broader insight into it and also give some support for our wonderful ladies who are doing so much. So I've heard this growing up, and I want to find out, Des, I've said it to you before, and you're like, really, Chuck? This was a myth that people had growing up. And I want to find out if it's true or, that women cannot get pregnant when you're nursing a baby. So Miss Elise, tell me, is this factual or this is completely mythological?
Well, I don't know if I want to say yes or no, yes and no, because breastfeeding does offer some sort of control of fertility, and that's because hormones that are released during breastfeeding prevents the woman from ovulating. However, if a woman is not totally and fully breastfeeding, that's breastfeeding your baby 3 to 4 or every 3 to 4 hours, breastfeeding only. That theory will not hold true, and then you will find yourself in a situation quite quickly if you rely only on the breastfeeding as a source of contraceptive.
And that being said, one of the things that you hear some people say from time to time, they'll have a really newborn and have another one, say, oh, this wasn't planned. I was breastfeeding and I thought that was enough birth control, and that's the reason why I bring this up, because this is still common in a lot of societal talk, and young people think that this is true, but that is not the case. As Nurse Elise just indicated, you really have to be aware of the facts completely with it.
What about the theory that once you've had a hysterectomy, you no longer need to do a pap smear as a woman?
Well, you also have to bear in mind that there are different types of hysterectomy.
Okay.
You have what is called a total abdominal hysterectomy, where the uterus along with the cervix is removed. However, you have what is called a subtotal hysterectomy, where the cervix is left. And the cervix, that's where the sample is taken from for your pap smear.
Okay.
So you have to clarify with your doctor whether your uterus and everything has been removed, or in fact, you do have your cervix remaining, which does happen in a few cases, or I should say in a lot of the cases.
Okay.
So it's really depending on the
type of hysterectomy you've actually had.
And also the variants that your body has taken on with that. Okay.
Yeah.
And when you say hysterectomy, maybe there's some people who don't know exactly what that is. You started to elaborate on what it is. Tell me exactly what is a hysterectomy and what it's used for.
Okay, so hysterectomy is a surgical procedure in which a woman's uterus or womb is removed. And this could be for several reasons. One of the most common reasons is fibroids. And fibroids are benign growths on the uterus, and is pretty common, especially among Black women. I know that's definitely something any conversation about women's health, I believe fibroids would end up being part of the conversation, unfortunately. And so there's a whole realm, and I believe that fibroids, it can be genetic. So if your parents had it, and it affects so many aspects of the woman's well-being and health, because uterine fibroids can cause heavy periods. It can cause painful periods. It can affect fertility if they become large enough. And sometimes women don't just discover it at the time when they're trying to become pregnant. So it is such a subject that I feel so strongly about in terms of women being aware of what's happening in their bodies. And perhaps, even though ultrasound is not a part of a screening tool, perhaps it's something that we should visit for women so that they don't discover when they're trying, because women now have put off childbearing to after school, after they finish their 7 to 10 years of, and then when they come and they're ready to have children, they discover that they are having issues because they have not small fibroids but huge fibroids.
Nurse Eleisa, sometimes people have the idea that miscarriages are caused by stress or by lifting heavy objects. Can miscarriages also be caused from someone having fibroids?
It can be, because fibroids can grow in many locations. We have what is called submucosal fibroids that grow within the lining of the uterus. You have endometrial, subserosal fibroids that grow outside the uterus, and those also that are in the muscle. So depending on where they are, they can contribute to a miscarriage. And a common myth too is that sometimes when women miscarry, they sometimes blame themselves, or they wonder if something is wrong with their bodies. And did I do something wrong? A lot of the times when women miscarry, especially for maybe 1 or 2 times, we can't explain what caused it, and sometimes things aren't just forming well, and the body just has a way of preventing the growth from continuing. And so, although it's an emotional and kind of a rocky road, if we could empower women to know that, okay, there are things that you can do, like taking off folic acid, having a balanced diet that contains vegetables and stuff that supply all the nutrients that you need, especially for the development of your baby in the early trimester, then that will assist in preventing a miscarriage.
It is sometimes said that once a woman gives birth by C-section, she can't give birth naturally afterwards. Myth or fact?
That's actually a myth. It depends on the reason you had a C-section done in the first place. There are some cases where it might be an emergency C-section. For example, the baby there's some fetal distress, and
okay.
to get the baby as quickly as possible, then a cesarean section has to be done. But it doesn't mean that all the deliverance subsequent to that. It's dependent on your medical state, whatever predisposing factors and or medical issues that you might be experiencing. One, the doctor may decide to do a trial of labor and see if you could have the baby naturally.
Okay.
So high blood pressure and things like that would definitely play a thought into having a C-section birth, but still being able at another given time to give birth naturally.
Yes. So whatever is happening in this pregnancy might not necessarily happen in the second pregnancy or the third pregnancy.
Okay.
Understandable. While I got you here, one of the things I wanted to ask about was we started talking about breasts and actually doing self-testing and things of that. Is breast cancer only affected with women who have a history of breast cancer in their family?
No, unfortunately not. And the cancer fight is such a bold and a worldwide fight that women and men, because believe me, although we are in women's health, men do have breast cancer, Chuck. And it's not only genetic. And there's also a myth that says that as you get older, the risk also decreases. But there are a lot of women, for example, at 50, who are now discovering that they have breast cancer. A family history gives you a higher risk of getting breast cancer, and there are different types of breast cancer. Now we can do genetic testing. We heard a story about Angelina Jolie, who decided to do a double mastectomy, having found out that she is at higher risk for breast cancer. So there's genetic testing now that can be done to identify risk factors.
Exactly. Before we start wrapping up, let me just ask you, you're on a stage, what would you tell women to do? In your humble opinion, what do women need to start doing and focus heavily on to have a better existence for themselves?
I have a mouthful, and having learned myself, I don't want to tell you too much of a story, but I remember when I discovered exercise, and I would run morning and night, and that was at the detriment of my hip and my knees. And now I am learning, having made that mistake, that okay, I have one body and I can't really go to Parker's or some other shop, mechanical shop, to get supplies for this body that I have. I would love to be able to change some parts on it sometimes. However, that's not always possible. So not only from a medical standpoint, as a female, and this goes out to both men and women, if we could value ourselves enough to take care of ourselves, that involves eating right, and that could be an entire program by itself about diet and eating, and that doesn't mean eating boring stuff. It means exercise, and that means the type of exercise and mixing up the exercise. It also taking care of yourself as you get older, recognizing that your hormone levels change, your bone structure change, you're at risk for osteoporosis, and the type of exercise that you would need to strengthen your body. The importance of weight-bearing exercise, the importance of self-care, the importance of rest, the importance of giving yourself a little grace, and knowing that sometimes things don't always go the way you want it to, but that's fine. You might fall down, you may make a bad decision, but get up, brush yourself off, and keep going. Never give up. And of course, those tests that we recommended, your pap smear, your mammogram, your breast self-examination, your colonoscopy when you reach the age of 40, the importance of visiting your physician at least annually to make sure that everything is as it should be. The checking of your blood sugar, the knowing of how you feel, the pulling back, the resting, the importance of taking care of the only you that you have. That's what I would say to all the women and men who are listening.
Thank you so much.
Perfect. Thank you so much for being a part of our discussion this morning. We appreciate and value and I hope it has put the synapses on somebody firing to do better and to work towards a better themselves.
Yes, and it's especially important because, March is Women's Month. So thank you so much again, Nurse Eleisa, for being on the show with us this morning.
My pleasure.
Take care. We'll talk again soon.
Okay, then, bye-bye.
Take care.
In celebration of Women's History Month, BAF Insurance salutes the women of the Cayman Islands. We know that everyday women are superheroes every day, helping others, loving and nurturing, taking charge and building our country's future. Happy Women's History Month from BAF Insurance, providers of quality affordable health insurance for individuals and groups of all sizes. Give us a call at 949-5089.
Your health, your wealth, your health, your wealth, your health for life.
Your Health, Your Wealth is brought to you by BAF Insurance. Your health, our priority.
And we are back. Desiree, do you know what time it is?
What time is it?
It's time for me to welcome back your colleague, Mike Adams of BAF Insurance, once again for 3 minutes with BAF. How soon after I buy my health insurance policy does my coverage kick in? Is it right away or do I have to wait?
Once the application is submitted to BAF, the application is sent to our underwriter for review and approval. This process normally takes roughly 5 days. And policies that are approved prior to the 15th of the month would go in effect on the 1st of the current month. If the application was approved after the 15th, the policy would then go in effect the 1st of the following month.
And Mr. Mike, suppose I get sick on the weekend and for some reason I need approval for something like medical evacuation to the U.S. What happens?
Providing you need to see or visit a medical provider over the weekend, you would certainly provide the BAF ID card that the individual has. And on the reverse side, it has the contacts for BAF. All of the hospitals have our 24/7 on-call telephone numbers, as well as if we may have to airlift someone out of Cayman to, say, Florida. All of the hospitals have the 24/7 contacts for BAF.
Thank you so much for the information.
Again, my name is Mike Adam. 949-5089 is our main office line. BAF website, www.mybafsolutions.com.
Well, that's our show. Lady K gave us some tips on fibroids for our ladies and skincare advice for everyone. Remember to check out Lady K's videos on the Be Well, Be Healthy for Life channel on YouTube.
And don't forget to like and subscribe and share with all of your friends. Those videos are super, super important and informative.
And they're health tips that are brought to you free by BAF Insurance. The YouTube channel is Be Well, Be Healthy for Life. And you can also catch up on your health, your wealth shows that you missed on the same channel.
That's so true, Des. And don't forget our wonderful guest that we had today.
Oh, yeah. We heard from registered nurse Eleisa Thelwell. She gave us so much information to ponder.
All of the valuable information on women's health and how to go about checkups and all of the routines that you need to do. Thank you so much for that.
Well, until next week, we are Desiree.
And I'm Chuck Taylor.
Encouraging you to start now to live a healthier, happier life.
In celebration of Women's History Month, BAF Insurance salutes the women of the Cayman Islands. We know that everyday women are superheroes every day, helping others, loving and nurturing, taking charge and building our country's future. Happy Women's History Month from BAF Insurance, providers of quality affordable health insurance for individuals and groups of all sizes. Give us a call at 949-5089.
your health, your wealth, your health, your wealth, your health for life. Your Health, Your Wealth is brought to you by BAF Insurance. Your health, our priority.
This program is brought to you as a community service by BAF Insurance. The views, opinions, and advice expressed by guests on this show are those of the guests and do not reflect the views, opinions, and advice of BAF Insurance. For medical advice, please visit your medical professional.